which hand to glove first? Dominant or non-dominant? Okay, well, I use my dominant hand first. I glove the dominant hand. I cannot do this opposite, okay? So you pick up the glove, okay, at the cuff, at the fold of the cuff, okay? And you're gonna put your thumb inside your palm, and you're gonna slip the glove on, okay, over, and then pull the cuff up like so. Then you are going to go underneath the cuff of the other glove. Your thumb is out. You're going to stick your thumb in again and pull up. Ta-da! Okay, now you've done this. Okay, you can do this, but you need to keep your hands above your waist and in your eyesight at all times. Okay? So you're going to go home with these kits, and you're going to actually practice the gloving, because I'm going to watch you all glove. I'm going to watch you all do this independently. Okay. Now this is another drape. It's a fenestrated drape, and the reason it's called a fenestrated drape is there's a nice hole in the center. And what this is supposed to do is go over the patient like so. I don't use it. It's one more thing that I have to worry about, and I'm not. Once you put the catheter in, then you're going to have to try to tear that, and it's not always easy. Okay, that's one more less thing I need to worry about. Okay, so next I have is providone iodine sticks, or you may have other antiseptic wipes. Okay, so we're not going to do these on the mannequins. You'll just tell me, okay? And then you'll have lubricant, okay? And you'll have your saline syringe to fill the balloon, okay? And then you'll have a container if you need to capture a urine sample, okay? So I'm just going to set this off to the side, because inside now is the kit for the actual catheter, okay? There is a sleeve that goes over the catheter. You have to remove this very carefully, and the way that I recommend that you do it is as you pull this off, is that you wrap it around your hand, because otherwise if you wrap it off, it's going to go flopping and it's going to hit something, okay? Then you're going to take your cap off the syringe and just attach it to the end of the balloon port. We used to be able to test the balloon before we inserted it, just to make sure that it did inflate, but we don't do that anymore because it supposedly weakens the balloon, okay? Which, if it ain't functioning and you put it in and you go to blow up the balloon, it doesn't blow up, the catheter's coming out, okay, and it's going to leak. So I'm just following policy now. You don't insert it, okay, I mean inflate the balloon. So we're just going to put everything right back here, okay? Very carefully, keep it inside this little box. So, next thing we're going to do is open up our swabs, and I'm not going to open this up, but I'm going to demonstrate what you would do, okay? But I also need to open up my lubricant, okay? Now, what they're telling you now, there are some kits that actually have a syringe full of lubricant, and it's okay to, on a male patient, not on a female, but on a male patient, is to go ahead, after you've cleansed the meatus, to take that syringe and inject all that lubricant right into the penis. It actually helps the catheter go in, okay? But it may very well clog up the end of the catheter, the port. So we just need to be mindful of that. So if you don't get urine right away, that may very well be it, okay? But it helps in that process. So I'm going to open this up. There we go, okay? So you'll just squeeze a little bit out, okay, onto your sterile field, okay? Now, what I'm going to do is I'm going to take my swab sticks. Now, there are 3 of them here. You have to open these up and lay them out onto your sterile field, because if you don't open these up now, you're never going to open them, because you're going to only be working with one hand, okay? So you'll take one out, take them out, and put them on your sterile field, okay? So what you're going to do next is you've got to separate the labia, okay? Because you need to get that good visualization, okay? So you separate, and once you start separating, this hand is now considered contaminated, okay? So you can't let go, okay? So you take one swab stick, you'll go down one side, toss it. Pick up another swab stick, go down the opposite side, toss it. The last one goes down the center, okay? So then you're ready to pick up your catheter, dip it in your lubricant, and you're going to insert, okay? On a female, how far do you go? 2 to 3 inches. On a male, 5 to 7 to 8, okay? So we're going to insert, okay, and we're going to look for the liquid gold, okay, because that's what it is, liquid gold. There we go. So what you need to do now, once you've got that going, you want to insert another inch, okay? And then you are going to inflate the balloon and watch your patient's expression as you do this, because if the catheter balloon is being inflated, the patient's facial expressions are going to change. Okay? While holding down the plunger on the syringe, you are then going to pull back until you meet resistance. Okay. It's overfilled. Okay? So what this means now is that once you feel resistance, okay, the catheter now is resting on the bladder neck. Okay? So then you would hold this and put this down below the patient. Okay? So you would then attach this to the leg with that strap or with the stat lock, okay, right here on the leg. You've finished cleaning them up. Okay. Put them back in a comfortable position. Okay. Okay, and then just ask them if they need anything, if they feel uncomfortable, or is everything okay? Then you're going to go and throw your kit away and document. You're going to document the date, the time, okay, the type of catheter you inserted, the size of the catheter, okay, which is a 16 French, how much water you instilled into the balloon, which on this catheter is 10 ml, even though it says it's 5, 10. And then you're going to talk about coca, color, odor, consistency, and amounts of the urine. Okay? And if the patient tolerated it well, did they show any facial grimacing or pain or discomfort while you were doing it? Okay? And that's all there is to it.